This video is just to describe the basic use of the slip trainer and how to do that safely. So before you get somebody on the slip trainer, first assess the patient to make sure they don't have any contraindications that would prevent safe use of the slip trainer. You're going to have to place them in some type of harness system, whatever harness system you have. And I always like to provide a warm-up to the client before doing slip training. So some type of walking on a treadmill, recumbent bike, dynamic stretch type warm-up before you initiate slip training. So first thing to do is get on the slip trainer is you're going to bring the slip trainer right up to the client. You can place your foot directly on the board and pull the board into your waist here, and pulling the handle up into your waist, and have them step onto the back of the board. Good. And then I'm going to slide it gently forward or backwards as they walk forward onto the slip trainer. Good. And I'm going to get this underneath the center of our arch here, just nice and easy here. Good. Now that we're in the center of our arch here, if I need to take up any slack in the harness system, I'm going to take up a little bit of slack there. Can leave as much slack as you feel comfortable with the type of client you have and their level of balance. So now that we have you on the slip trainer, what I want you to do is, first of all, is just get your confidence. You know, I'm not going to slip or trip you right now. I'm not going to make you fall. Initially, I want you to just experience what it feels like to be destabilized a little bit. So first thing we're just going to work on is very small movements that just involve your ankles, okay? So I'm going to move the board back and forth just very lightly and see if you can move just at your ankles without taking a step, okay? So just want your feet comfortably width apart there on the center of the board where the weight max logo is in the middle of the board. So here we go. We're just going to go back and forth a little bit, just very tiny movements, half an inch to an inch, and just looking at their ankle strategies, giving them a little bit of confidence in what's going to occur here. So now that we've done a little bit of that, the next thing we're going to do is we're going to move just a little bit bigger, and that might mean you need to move your waist a little bit and your trunk a little bit to accommodate for that. You probably don't need to take a step right now, but if you do, just take a step if you need to, okay? So now we're going to do a little bit bigger movements that might require a little trunk strategy and hip strategies. Good, good. Now that we've explored ankle and hip strategies for reactive training, we want to go ahead and actually induce some reactive steps. So first of all, what I'd like to do is just say, I'm going to tell you which direction we're going to push this. We're going to push it straight back, okay? I'm going to push it straight back in a moment here. That's going to require you to take a step forward with your foot. You can be either left or right. I want your feet weight equally distributed, and just take a step forward with whatever foot you feel comfortable when I push the board back. Okay, so are you ready? Mm-hmm. So I'm going to push the board back. Good. So you took a little step there. Great. Now go ahead and recenter yourself. There you go. I'm going to bring you back to the center here. And we are going to do the same thing one more time forward. Good. Come. There you go, right there. Okay. And we're going to also now do that and have you take a step backwards. Okay, so now I'm going to pull the board towards me, and you're going to need to take a step back. Okay, I'm not going to take probably as big a movement here with that, but let's just do a little step backwards. Good, catch yourself. And you'll notice with every time I do a slip or a trip, once the slip or trip has been made, I stop the board by stabilizing it against my hip. So when you're providing the slip or the trip, you really want to use your body. See, I'm in a nice wide stance here, and the lower the handle, the easier it is to drive the board directly forward or pull it back. So you don't want the handle too steep. You want it down a little bit lower here, maybe 45-degree angle. And then using it against my thigh is how I can really provide these slips and trips. Okay? Speed of the movement is just as important as the amplitude of the movement. So there's no ideal. It's based on the patient's capabilities of how much slip or trip you provide. In this whole process, I'm looking at the patient's reactions. Are they fearful? One of the things I often tell clients is relax. Let your arms relax. I want you to feel equal weight on your feet. Feel the distribution between your ankles, your heels and your toes. You want equal weight, so you're prepared for any destabilization. So once we've done a few practice of steps in a directions that they know that they're going to be slipped in, we can do more random slipping and tripping. So we're going to do the same thing, but more randomly. And right now her eyes are open, and while we're doing this, so I'm just going to do a few random slips and trips. You're going to have to take a step, okay? Good. Now get back in the middle. Good. Let's do another one. Good. get back in the middle here. There you go. Good. So that's the more random. And then as the patient progresses, right now with her eyes open, she can maybe get a little prep ahead of time, expecting when I'm going to make that slip or trip. You can have the person turn around. So turn around and face the other direction. I'm not going to do any slips and trips now, but we could do our slips and trips with her facing the other direction. You could do eyes closed as another more challenging opportunity. You can do that. Now let's do a side stepping. So go ahead and face that direction. There you go. Come to the middle of the board there, line up in the middle there. And anytime the person is moving on the board, it is good to hold it against your leg or place your foot against it and hold it with your foot and pull the board into you. That'll make it feel like a stable surface. Anytime you're doing sidestepping, we want to have the feet pretty close together, okay? So they're going to have their feet fairly narrow to induce that slip or trip. If they have their feet wide, you can destabilize quite a bit without needing to take a step. So same process, I'll do little tiny movements and just kind of try to get them to experience without taking a step. Try not to take a step. We're just going to do some very small movements. Bring your feet a little closer together. I'm just going to go tiny movements. You can deal with those with your arm and your trunk. There you go. Good. Now I'm going to go a little bigger where you have to take a step. I'm going to push it towards you right now. I'm going to push it towards you, and you're going to probably have to take a step to your left. You ready? Good. So again, I'm warning him a little bit when we start this, and then we get more creative and more random with our slips and trips. Go ahead and turn around and face me. We can also certainly involve things like dual tasking, so asking them to count backwards by threes, having somebody in your clinic toss them a ball while we're trying to do slips and trips, holding onto a tray with a ball supported in the middle, trying to balance that ball. You can get quite creative with using this device. The other thing you can do is you could even place a chair on this or a plyo box and have them sit on that and do sitting perturbations and induce more trunk destabilization in a sitting position as well.